The prevalence of abdominal wall hernias is 2% in the general population. For example, in Bangalore, out of a population of 1 crore, there are approximately 2 lakh patients with abdominal wall hernias. Now, groin is an important site for hernias in men, and men have 20 times more higher incidence of groin hernias compared to women. Women, in comparison, have a higher incidence of umbilical hernias or paraumbilical hernias. Hernias do occur at other sites in the abdominal wall. Now, what is a hernia? A hernia is a protrusion of contents of the abdomen through a weak area in the abdominal wall. Now, there are about 10% of patients who undergo abdominal operations who can develop a hernia, and these are called ventral hernias. So where the abdominal wall is closed, the muscle is weaker, and so hernias do develop. So if you look at women, the incidence of cesarean sections has increased in the last 2 decades. Therefore, we see 5 to 10% of women undergoing cesarean sections developing hernias or ventral hernias following surgery. Patients presenting with a hernia typically complain of a swelling in the region. For instance, if it is a groin hernia, in that region, the patient has a swelling which appears, particularly while straining, particularly while coughing, while passing motion, because the pressure in the abdomen increases, and this pushes the fat or intestines through the weak area in the abdominal wall to the exterior. For a patient with an umbilical hernia, they are present with a swelling in the umbilical region. There are 20 to 25% of these patients who present with pain, a dragging kind of a pain, or sometimes what we call a colicky pain if they present in an emergency with an intestine which is stuck within the hernial sac. 1 in 5 patients with a hernia can present as an emergency with intense pain, and when they present with colicky pain, they could have intestine which is blocked within the hernial sac. The causes for hernia are many. Although many hernias happen without a reason, patients who have chronic cough, patients who have been having chronic constipation, straining at stool, patients who have males who have prostatic problems, typically seen after 45-50 years of age, where they strain while passing urine. All these which raise the pressure within the abdomen are known to increase the incidence of hernias. In women, multiple pregnancies, absence of exercise during pregnancy are known to result in hernias, a weak abdominal wall, and increased incidence of umbilical hernias. All patients who have undergone a previous abdominal operation stand a higher risk of developing abdominal wall hernia. Typically, the risk is placed at 5%. Hernias occur in 2% of population. These are common problems which present typically as a swelling in the groin, in the umbilical region, or in the previous operated site, particularly when one strains, and during straining this causes a fat or intestine to bulge out from the site of hernia. Now, one should not ignore an abdominal wall hernia because 20% of patients can come with complications. The complication can be serious, such as an intestine trapped in the hernial sac, which can cause a loss of the intestine. So, if you have abdominal wall hernia, remember there's a 20% chance that you can present as an emergency. It would be prudent to visit a surgeon before such a complication arises so that you are appropriately evaluated and your problem is fixed surgically as found appropriate. Abdominal wall hernias need treatment in the form of surgery. Now, in children, one might get away by just closing the gap in the muscle with sutures and without a placement of a mesh. But all adult hernias typically require placing a mesh support with or without closure of the defect. Provision of the mesh adds strength to the abdominal wall in the region of hernia. Hernias can reoccur after a surgical repair. For groin hernias, 1 to 2% of patients can come back with a hernia after a repair. For a ventral hernia or post-operative hernia, a repair is associated with a reoccurrence chance of up to 5%. For children who have undergone umbilical hernia repair, later in their life, there is a 2% chance of a recurrent hernia.